Welcome to MDnews.com. I'm Charlie Milburn. We're reporting to you from San Diego, California at the site of the American Hospital Association's Leadership Summit. One of the hot topics that medical executives were speaking on was Medicare reimbursement. Here's what some of them had to say.
Well, obviously that there needs to be a permanent fix to that because, the fear among physicians, I think, is that the government, because of budgetary constraints, will turn Medicare into Medicaid. I mean, Medicaid right now costs you more to send out a bill than you collect, irrespective of what the service is in most cases.
I think it's just delayed the hard work that has to be done to correct and permanently fix the physician reimbursement fee schedule. And because of the uncertainty, especially this last time in June when they missed the deadlines and the SIMS had tried to extend it, but by law they can only go so far. It creates uncertainty in the medical practices and the ability to, it's limiting, it is actually limiting access for seniors because physicians are hesitant to take new seniors into their practice, for example, because they don't know, a 21% and soon to be a 26 or 30% reduction, and that fee schedule is not a robust fee schedule to start with.
In the small community hospital, critical access hospital, the reimbursement from Medicare is based on cost reimbursement. So we get reimbursed 101% of our cost. And it's enabled us to actually keep services available in a small rural setting. The physicians, however, the family practice physicians, don't have that type of reimbursement from Medicare, and it gets harder and harder for them to maintain services when their client base is small, and it really makes it difficult to keep the services available in a small rural setting.
I hope that the reimbursements from Medicare will, not go down, because I think that then threatens access for that segment of our population, which is growing, obviously.
Well, I'm hoping that the Congress will come up with a permanent fix. I think that the SGR formula, I believe that's what it's called, is not a good formula, and they need to come up with a fix. But where they get the funding from some other area to concerned about the deficit as everybody else is, it's really but I think that we're going to increase access to care with this new health care reform, and yet we are making it more and more difficult for providers to be willing to take that. It's kind of a dichotomy that's not workable.
When Capitol Hill starts making policies, they've got to remember the small rural setting, especially in the Midwest where I'm from. That's where most of the people are living, and it's the harder services to get to them.
So now that we've heard their perspective, we want to know your perspective. Click on the link below that says share your perspective to let us know what you think about Medicare reimbursement. Reporting from San Diego, California, this is Charlie Milburn for MDnews.com.